from a personal perspective, it's been really sort of incredible to see the rate of information that's come out about this virus in such a short period of time, in a time where a lot of healthcare facilities are sort of furloughing people or operating at minimal staff. What's it been like for you as a researcher? I'm sure you've been busier than ever. What's it been like
Yes.
from your perspective compared to how it's been throughout the rest of your career?
Yeah, so it's been an extremely busy time, as you might imagine. And my job generally is to kind of assimilate information. So the main thing I do is evidence synthesis, which means bringing together data from lots of different studies to come up with kind of a best approximate reflection of the state of evidence to help inform policymakers and guideline developers. And so the absolute sheer pace and volume of data coming out during this has been hard to stay on top of. And some of the evidence has also been very, very poor. But it can be difficult, especially when you're looking at articles that are preprint only, so haven't been peer reviewed yet, to understand what some of the weaknesses are in those studies without reading them fully. So I find myself having to read a lot of papers, and then some of them by the end saying, actually, I just discount this entirely, but I can't really figure that out until I've read it. So I've been quite busy in that way. I think for me on a personal level, it's been a very busy time, but I can't imagine anything I'd rather be doing. I feel extremely privileged to be in a position where I can do research in this area and hopefully help contribute to knowledge and to the care of people with diabetes and people like me. And I think science, when it's at its absolute best, is a collaborative effort. And we are seeing, in many cases, some really strong collaborations, both internationally and within countries, to try and get the data out there. And so it's, I feel just very, very grateful that this is my job at a time like this. I'd rather a time like this had never come around, but if it was going to, I'm glad that I'm in the role I'm in.